I'm Dr. Elizabeth Harris. I'm certified by the American Board of Plastic Surgery. Many of you are interested in some type of cosmetic surgery procedure, and I think it's very important to find out the selection process for choosing a surgeon that you're going to trust to do your cosmetic surgery. The Plastic Surgery Society has very strict stipulations of what a board-certified plastic surgeon is. And first of all, the criteria process for becoming a board-certified plastic surgeon is very strict, and I'd like to go through a little bit of the process that's involved with the study of plastic surgery and how we become certified. First of all, plastic surgery involves some type of prerequisite program. Many plastic surgeons are either general surgeons or else they're from the ear, nose, and throat study, or even from neurosurgery. And usually most of us have a 5 to 6 year fully accredited surgery program training before we are even allowed to select a plastic surgery program. After that, the plastic surgery residency is about 2 to 3 years. Again, very rigorous, encompassing many different types of plastic surgery. And after that process is completed, then what we have to undergo is a board certification process. So after a 7 to 8 year residency, we then have to undergo very strict oral and written testing in order to get our certification process. This is in contrast to many different surgeons or even standard medical physicians who choose to do plastic surgery procedures. And the reason that the background is so extensive is so that we can handle the full standard of care for the patient. We have to be able to choose the patient's care, whether somebody is a candidate or not, and being able to say, no, I don't think you're a candidate for this procedure is very, very important. Second, not only the training and the finesse of doing a surgical procedure is important, but also being able to take care of the patient afterwards. Some patients have complications, and to be able to properly train and be able to treat those different complications are very, very important for the surgical process. Most plastic surgeons also train at and work at an accredited medical facility. These surgical facilities are very difficult to get privileges in as well. And most people think that for a surgeon to operate at a hospital, they just go into the hospital and ask to work there, and it's not true. You have to show your different training background, how your surgical program was incorporated, as well as what type of testing and your qualifications. And it is very, very difficult to get operating room privileges. So when you look at a surgeon's work technique and find that they are working at a accredited surgical, frequently hospital-based surgical facility, the screening has been already processed in order to allow them to operate there. Something that's also very important is a surgeon's strict code of ethics. Again, a plastic surgeon doesn't just take a weekend course and learn how to do a surgical procedure by watching somebody else. Again, our training is very extensive, and from that extensive background, we are able to take care of a patient ethically. We also have very strict continuing medication requirements that we have, and in order to maintain these surgical procedures that I've already discussed, we have to be able to continue to grow on our background. And in many plastic surgeons fields, we also do teaching, and I frequently teach and instruct both residents as well as some other plastic surgeons in regard to some of the techniques that we do, and that's a very, very important part of our background. The standard of care is essential for safety. Our patients have to understand that some patients are not a candidate, and to be able to understand if a doctor tells you that perhaps you're not a candidate for this procedure, but there may be some other less invasive options, that's a sign of a good doctor. It's not a sign for a patient to have any type of surgery they want, because then you can have complications. And again, being safe, being ethical, and understanding what different options are available to you are essential for choosing your plastic surgeon. There are many different innovations of plastic surgery. Our field is constantly evolving, and from that standpoint, many plastic surgeons go to different types of surgical meetings every year in which we discuss different ways that we can improve our technique. And to go to the Plastic Surgical Society meetings, this is something that allows us to continue to grow and to offer you even better techniques as they develop. The procedure itself has to be discussed with a board-certified plastic surgeon. There are many different types of surgical procedures that a plastic surgeon offers, and the important way of determining a plastic surgeon's qualifications is go to the website. The American Board of Plastic Surgery has a website that shows certified plastic surgeons in your area. The Plastic Surgery Society will give you lists and guidelines in regard to different options available to you in your area, and you should talk to at least one plastic surgeon for understanding a technique, and most plastic surgeons do recommend getting a second or a third opinion. I consider it to be a good education for a patient, and in regard to that, if a patient has seen more than one plastic surgeon or has read about the plastic surgery on the websites, I think that patients are more educated and can better understand what's involved with choosing the procedure. In regard to that, this is something that there are many different websites that are available to patients to look at, and you have to be very careful for choosing those websites. The American Board of Plastic Surgery, again, has very detailed information that you can read before visiting a plastic surgeon, and that may help you with your selection process. In regard to the criteria for the selection process, again, looking at the different surgical procedures and determining where you may be interested in having the procedure, talking to different plastic surgeons, but just be careful of going to some of the websites that may provide some erroneous explanation, and that may be more confusing before you do see your plastic surgeon. In regard to the surgery, choosing your plastic surgeon is very important. My name is Dr. Elizabeth Harris, and I am certified by the American Board of Plastic Surgery. I have a office over North Central Baptist Hospital at 540 Madison Oaks, Suite 400, and my telephone number is 210-545-4848.